What is happening that over the last 5 years, many drugs have came into RCC world, especially with immunotherapy and TKI, tyrosine kinase inhibitor, especially combination therapy like ipilimumab, nivolumab came in, exitinib, pembrolizumab, and most recently lenvatinib, pembrolizumab, and cabozantinib, nivolumab came into the real world market. Now, what is impact? All this have done, we have clinical trials data, but what happens outside in community, outside academic centers in the United States? So that's why we did this study to evaluate that once this FDA approves this drug, are people using it? How often they are using it? And what happens, especially when the RCC field is moving very fast, and with all these new drugs coming in, what happens? What happens to patients? What do they take in second line? What do they take in third line setting? So that was the primary purpose of that poster. So we looked at US Oncology McKesson database, which has over 1,300 providers across 430 sites. So it covers entire United States. Mainly their oncology practice are in West and South are very heavy. East is a little bit less. And we look at that chart and we look at the trends of this medication, what happens. Interesting finding what we noticed, which you can see in our poster, that early in 2018, TKI were predominant drugs being used. And April 2019, Ipi-Nivo become FDA approved, and April 2020, Exi-Pembro become FDA approved. And once they got approved, you can really started to see steep incline in those medication being used, and that is actually very reassuring. What we found that our study observation period ended in September 2020, and by that time we noted that TKI has steeply declined, and immuno-oncology drugs including Ipi-Nivo combination therapy and IO TKI therapy had really take over the majority of market, which is very reassuring to see that, especially in community oncology, because we know they are associated with survival outcomes. The second part of that poster was that, okay, now you do these new drugs in first line setting, what happens? What do you do in second line and third line setting? And interesting finding, what we noted, that those patients who got first line TKI, they were using more of IO therapy, nivolumab and ipilimumab. Nivolumab were the most common therapy, and those who use this IO combination based therapy like TKI monotherapy, especially cabozantinib, was the most common second line and third line drug we noted in our studies. Interestingly, we also started to notice a little bit of IO TKI and IO in second and third line settings. People are using that. So those are the two main findings of that poster. First is that we do see that after FDA approval, all these drugs are being used in community oncology settings, which is very assuring. Those patients who received first line IO based therapy or IO TKI based therapy typically use second line TKI, and those patients who use TKI based therapy in first line, they use IO based therapy in the second line setting. Those were our main conclusion for those posters. Our data is, our median follow-up is about 7 to 8 months, so we are still going to follow up and see what happens over time. Our progression events to second line were about 30-40%. So once we have more event, we'll have more idea about how that landscape is evolving.